Welcome to Sex Care is Self-Care, a conversation brought to you by the She Plus Foundation. I'm your host, Patty Brisben. Today I have an amazing guest, Dr. Evan Goldstein, founder and CEO of Bespoke Surgical. Now, I got to meet Dr. Goldstein several months ago. We had a speaking engagement in regards to sexual health. And I came to your office, beautiful office, by the way.
Oh, thank you.
And I just fell in love with you.
Oh.
And the reason being is there's no play, so to speak. You hit things on head on, and you don't think twice about it. You're a straight shooter. And I think in the business that we're in, we have to be. And I had so much respect for you. And I came back and I went, can we get him on our podcast? Because I think that anytime that we can educate the public, it's a better world. So right now, what I want you to do is I want you to tell our listeners who know not a thing about you, and some of them who are listening might, yeah. They could just be fanning. And I want you to tell them exactly what you do on a daily basis.
Yeah, sure. Well, thank you again for having me. So I never thought I would do what the hell I'm doing now. I started with cardiac surgery and I was doing hearts and I was miserable. And I was looking at who I was as an individual myself. And I met Andy, my partner. We've been together for 20 years. We have 2 kids together. And during this time, I started to look at my own sexual world to figure out, well, wait a second, what am I happy with? What do I want to do? What are societal pressures? And then you started to realize that, well, wait a second, especially from an anal perspective and anal sex, that you can't just go from nothing to shoving it in. And so that was really the birth of my surgical practice, because I kept saying, well, where do people go for this type of care? Where do they go for this education? And if, especially on a community perspective, now I'm a gay male, I engage in anal, but anal's for everybody. Everybody's got an asshole. So for me, it was more of, how do I look at different communities and provide the care, but also the education to allow people to get into the sexual world that I know that most people want. Anal is, and we'll talk about the positive pleasures and all these nerve endings. And when people are trying to get into it, how do you do it safely? How do you use the right products to support the way that you're engaging? And then if something were to go wrong, well, where do you go? Who do you talk to? And how do you create the appropriate algorithm so it's successful for you?
There you go. And thank you for the work that you do. Dr. Goldstein, you built your career around sexual health in spaces that medicine has historically ignored or it stigmatized. When you hear the phrase, sex care is self-care, what do you think about? What does that mean to you?
Yeah, I mean, I think it's all about you. It's all about learning your own body, your own anatomy, your own understanding, and figuring out, I think when you look at, let's just go dive right in. Most guys are just going to shove it in the ass because that's what they want to do. But the reality is that if you know your own self, there's certain things that you need to do in foreplay or understanding in anal dilation and gradual progression to set the stage for success. So when you look at self-care in sex, it's so important. I think understanding your own body, playing by yourself, seeing what tickles you and what doesn't before you start to engage in others with others, because at the end of the day, that's where injury potentially happens. And how do we minimize that as much as possible?
Exactly. When you think of sexual health and especially pleasure, is there a disconnect from the mainstream healthcare conversation? Are doctors asking you about this in the office? And if so, should they be?
So the answer is yes, everybody should be talking about sex in a huge way. And the answer
Yeah.
is no, they're not. I mean, I did a study very early on in my career that looked at 92% of gay physicians aren't asking their gay clients about gay sex. So I think the world is definitely improving. Things like what you're doing and podcasts and the narratives in the media, people are talking more, but I find that most people are going to Google or ChatGPT versus then going to their physician. And the physician should be much more forthcoming. I wrote a book called But Seriously, and in that book was also for physicians of how do you ask the right question? How do you ask questions and not be offensive in a way? How do you target all of these things so people feel comfortable? Because at the end of the day, there's so many things that people would do sexually if it was confronted in a way that was positive, forthcoming, and really out there for them to explore.
Exactly. A safe space to
That's
be
right.
able to learn more, know more, and be able to act on it in a safe way. And I'm finding too, and all in our world, our doctors are, if it are being just, their curriculum is just their education. They're not, there's no outside, hey, if a patient comes to me about this, and if I live to see anything, I would love to see that change, because we're all people and we all live different lifestyles, and we should be able to have a space to find out more about our body and ourselves without there being shame attached. Um,
100%. And I also think that, you know, I always say to physicians when I'm training, you don't need to know the answers, but you need to know who does have those answers. And so I always say, if you don't feel comfortable in treating X, Y, and Z, that's totally fine. But you should be saying to your client, to your patient, hey, by the way, this is super important. This is why there's a specialty of this. This is who you should go check out or whatnot. But none of that is even entering the thought process of the physician. That's the limiting factor that we have right now.
well, it's definitely going to go up on our website, because I know that you teach on your Instagram site, correct?
Correct, all
Uh,
the time. Yeah.
all the time, I
Direct to
know.
consumer. You got to go
Yeah.
direct now. It's crazy.
You got to go direct. And so it will be up on our website on how exactly to find you. Anal health is one of the most misunderstood and stigmatized areas of sexual wellness. What myths or misconception create the most harm?
Well, I think realistically, it's like, oh, you must be gay to take it up the ass, especially in the male side of things, and you say to yourself, well, clearly that's total faux pas, right? I think
Right.
at the end of the day, there's so many pleasure zones in the human body, specifically anally. And when you tap into either the prostate or the A spot, which is where the prostate would be in someone born female, all of these things create such a huge heightened orgasm that those myths, societal pressures, your own religious, etc., those play so much into this. Where if we would just get people to think about pleasure and none
Hmm.
of those other preconceived notions, we would start to do so many other facets of sex that make huge amounts of sense. Now, I have chapters on myths and taboos. So, I mean, there's so many, but I think that's one of the biggest ones. Obviously, another one would be, oh, am I going to crap myself, or am I going to be too loose if I'm engaging, where I'm going to be pooping on myself, throughout my life, and all those other things, which is so far from the truth. If you're doing things correctly, trauma is what causes issues like that. So the issue is by understanding your architecture and the right ways to engage. I don't see that at all on my side of things, other than for like big toys, fisting, or extreme components. But I'm sure we'll get somewhat into more of this as we go through this.
Absolutely. Um, So, how does shame both socially and medically show up with patients in regards when it comes to sexual health?
It's interesting. There's so many different camps of people. Thankfully, when people are coming to me, they've done their due diligence and they've done a lot of research to truly kind of take the stigma out of it, knowing that I'm gay, I take it up the ass, I provide an environment that allows them to basically put that aside and say, hey, this is what I'm really interested in, and this is where I want to go. But there are definitely people that come with their heads down, or they come in and they're embarrassed about all these types of questions and situations that they found themselves in. I
Well,
think with that being said, it's how do like my office, like trying to provide a safe space, a comfortable space where people can really navigate, but it's also how I approach them. Sometimes I have to first start doing the question asking and try to
mm,
really talk a lot more. First, me doing simple stuff, getting them off the mindset of, oh my God, I'm in an anal doctor's office and I'm so embarrassed. And then slowly figuring out where we are and what we need to do.
there you go. What happens to people when doctors don't ask questions about sex, pleasure, pain?
Yeah, I mean, I think first off, there's probably a majority of people just don't ever get to experience the positive of it, right?
Yeah.
You look at there's so many people that come to me where they had a really bad first experience because of terrible education or a partner that didn't understand what they were doing. And then all of a sudden they're like, oh, nothing's ever going up my ass. But at the end of the day, if we were to say, well, wait a second, this is important to me, how do we navigate it in a very safe way to show you that it's not painful, that it's not discomforting, that you're not bleeding, and you're creating an environment that makes it that much more enticing to do? But there's a lot of hurdles with that. And it has to really do with whoever's listening to say, well, wait a second, this is important to me and sex is important. And this is another thing that I can do for me, my partner or partners. And how do we figure out how to do it as safely as possible?
So, if you have somebody out there listening today, and what would you tell them? I know you talk about a lot about preparation,
Yeah,
um, and as a form of care. Can you can you tell our audience what does that mean?
sure,
What is this preparation? So they have a
sure.
little bit of guidance here.
Yeah, I think first off, the preparation side is how do you just get into anal and how do you understand your own anatomy? So in my practice called Bespoke Surgical in Manhattan, we did many studies on looking at what type of pelvises you have. And there are basically three types of assholes in the world. Okay.
Mm-hmm.
The group number one, they're able to actually relax, they're able to open, they're able to feel comfortable and sexy and get into anal very quickly. Groups two and three are limited. It's either group two of sometimes it's painful or discomforting, sometimes I have limitations or I don't feel the pleasure, whereas group three is nothing's going in there, it's way too tight and it's limiting me. I think one of the things that I want the audience to understand is it's not overtly complicated. It's three components to engaging in anal sex. It's muscles. There's three sets of muscles. How do we get those muscles to relax? It's skin. How do we get the skin to open and accommodate? But also, how do we get the skin to be tougher? And that really is important, especially in women, because the skin is really thin in
Yeah.
women for child rearing. So that plays a lot into it. And then the third component is how is it connected to the brain? How is it connected neurologically and then psychologically? So, all of these things you as an individual need to figure out. Now, I do studies in the office when people come to see me to tell you what group you're in and what do you need to do. But many people, it's, well, how do I figure it out? And it's through anal dilators. Anal dilators are the key. I started a company called Future Method that really helps to marry products and science with sex all together. And one of the first products we launched with is an anal dilating kit of glass. And what that does is it starts to set the stage for my anal dilating protocol. The protocol is about 6 weeks. So let's just say you came to me and you're like, Evan, I've never put anything up my ass. I want to try. What do I need to do? And it's just like I do now, turning on the shower. Right before you get in the shower, it's just you. You're enticing, you're in a good space mentally, and you're literally starting with the small toy. And what you'll do is standing up, you'll take the small toy, you'll put a lot of lube, and what you'll do is you'll slowly start to engage those three muscles. First time you're going to hit the first muscle, you hold it there, three, two, one, you come back out. You do it again. And you'll see that each time, and we have lots of protocols on our websites, and I'm sure we can share it with you. But the first 2 weeks, you're just going to do the small toy. And through that, you're going to learn, like, how does my pelvic floor relax? What are those three muscles? How does my skin open up? Do I feel pleasure? All of those things. And it's not going aggressive. It's 2 times a week, going in and out 10, 15, 20 times. That's it. But what you'll do is you'll slowly start to set the stage for what group am I in? Can I continue to go the cadence of small toy for 2 weeks, then always starting with the small, then going into the medium for 2 weeks? And then you'll start to see by 6 weeks, you should be small, medium into large. I feel comfortable. It's opening up. I feel sexy, and I want to start to engage in anal. And then we could kind of talk about what that is. If in any point I'm having pain, I'm bleeding, it's not comfortable, well, you may be in group 2 or 3. And there's certain things that I do, anal Botox. Sometimes I need to do surgery to set the stage for success because of, especially post-pregnancy, skin tags and hemorrhoids and tears and
Yeah.
things that could limit anal in a pleasurable way. So there's a lot that goes into it, but it's honestly, it's not overtly very complicated. It's just being taught what's the right ways to do things.
Love it. Thank you. How can clinicians do better when it comes to talking openly with their patients about sex without making assumptions? So,
Yeah. I
yeah.
think it's just how I did it in the beginning was to just start asking questions. And sometimes you're going to ask the wrong fucking question, but that's
Mhm.
okay. You learn how to preface it. I just say it's very simple stuff of, do you identify? If you do identify, how do you identify? Straight, gay, bi, queer, where are you on that spectrum? And then from there, it leads to, well, what types of sex do you engage in? Oral, is it, penile, is it vaginal, is it anal, all of those components. And then from there, it starts to kind of push even further of, well, let's talk a little bit about going further. You don't necessarily need to get into the kinks of people if you don't want to, the first couple of sessions of talking to people, but we all have kinks. And I'm always like, whatever you want to do, whatever you want to shove up your ass, I'm totally fine with. My job is to make sure that you do it as safely as possible, or that you know what the risks are. And you and I are looking to figure out, well, okay, this is really my kink. How am I going to support that? The
Yeah.
days of saying, well, just don't do that. You know how many clients come in, same thing. Well, just don't engage. It's like, fuck you. No, this is what I want to do. So how are we going to get people into that space where they can do it comfortably and safely, and then have people that allow them? And once they get into an environment where they are supported from physicians, it's like it's a game changer because now it becomes psychologically improved. The
Yes.
psychiatrist, we're all working together to the betterment of their sexual lives.
There you go. That is such a true statement. Um, for people that are healing from sexual trauma, pain, or fear around intimacy, how can sex become part of the healing rather than pressure?
Yeah. So I think it's all first has to be, how do we get you into the pleasure zone, right? How do you get to lose your inhibitions? How do you look at past traumas and past failed, approaches to figure out how to set the stage for success? That's why we do so much work for younger folk where it's like, I want to get before you even have your first experience, because so many people have such terrible experiences where it scars them for life. And a lot of what we do in the office is, I tell people I do 60% functional work, 40% mental work. And Stephen, who's my physical therapist, probably is more 60% psychological work and 40% functional work because it all plays into. But I think it goes back to your self care of what do we deserve? What do you deserve? You deserve the best sex life possible. And if
Ex-
anal fits into that, how do we find the ways to do it the best, right? And that's it. We only have one life and we only have one sexual life, but that sexual life can morph into so many different things. It's so funny because my kid comes to me and says, "Dad, I have bad news." Like, "What's the bad news?" He says, "I'm straight." And I said, "Oh, I said, that's not bad news." I said, "You come out straight." I said, "But what you are now and what you develop, you have no idea because so many people
yeah.
morph and change and things happen. You have to be fluid in a way that allows you to experiment sexually and be so comfortable with that because then it just drives so much betterment in the space."
And it's great that you said this to your child because that opens that door and he knows that he can come to you with everything. You
Totally,
know,
100%.
I know I have that relationship,
Oh,
especially with
that's
my
amazing.
grandchildren. And
Yeah, oh,
so
that's so great.
yeah, and I love that. I mean, you've always got to have a safe space to land, you know,
Absolutely.
and trust the people that. And we talked about this earlier before we even started. Even having that poker face,
Yeah.
and just tell me, let me see if I can find somebody or help you through this. Um, I haven't told you this, but I am going to ask the audience here. I'm coming to New York, but I'm going to work around your schedule,
Oh, sure, sure, sure.
and we're going to do another one.
Yeah,
So for everybody that listened here today, send over some questions
I would love that.
because yeah, I'd like to do this again with you if you're willing.
100%. Yeah, anything that anybody needs, because there's lots of from how do you douche and what type of stuff do you do? What about fiber and diet and exercise and how
There you
all
go.
this plays into it? There's so much shit,
There's
pun
so much
intended.
shit to get to. I love it. So I just wanted to make that announcement, and I wanted to hold your feet to the fire of being committed to do another one
Let's
of
do
these
it.
with
Yeah,
me. Let's do it.
absolutely.
Okay, I always ask this question because I feel that I know there's a lot more to kind of go to on our next round. But is there anything that you want to add here today? Did you wake up thinking, gosh, I wish you would ask me this, or I really want to talk about that before we close out? Is there anything?
I think you hit really the good points from an introduction perspective, and then hopefully I tickled people to understand like that it's not just a shove it in situation. It's
Yeah,
really understanding. I think one of the things specifically on the female side is there's two things that are really important to understand. Most female pelvises are much more able to relax just because of it's geared up for pregnancy. So most people don't come to me with muscular issues. They're kind of in that category one of muscle where it could open, it could relax. The belly of the muscles are much thinner in female, born female. Now, the skin is the issue. Now, why do I say that? Well, first of all, I see a lot of trans from male to female, and the second they go on estrogens, their skin becomes a huge issue. And it leads towards tearing and what's called fissuring, where all of a sudden there's cracks anally. Where can you
yeah,
imagine putting lube and trying to have sex when this happens? So I think that there's so many things to kind of think about. But from a muscular perspective, able to relax. From a skin perspective, it's how do we strengthen the skin? And it's through toys. It's through creating very controlled friction in that space, very gradual. So again, the best guitarists in the world, they have calluses all over, but they didn't start like that. They gradually start to play more and more and more. And it's the same concept. How do we toughen the skin and how do we get the skin architecture to actually accommodate? Because the sexual force of anal sex is clearly greater than pooping. And so the key is how do we understand that? So I'm just tickling the audience a little bit to kind of think along the lines of differently. Another thing that screws with the skin is Accutane. Many people are on Accutane for the face, which is amazing, but it thins the skin. So you could see, I see 18, 19, 20-year-old kids coming to me with anal issues simply because their physicians didn't talk to them. They didn't ask them if they're engaging in anal sex. They have anal sex when they're on Accutane, and now they're dealing with chronic complications from that. So again, things for us to kind of think about, and I'm sure we can tease further, but it's a whole book. It's a whole book of stuff.
Okay, so here's one of my last questions. When having anal sex, do you always recommend using a lubricant?
100%. Yes.
Yeah.
I think silicone lube is the best lube for anal. 100%. You have to decide what works best for you. When you look at water-based approaches, it screws with the pH, especially vaginally. Same thing anally. So I think the other thing is stay away from the oils anally. I think that the reality is that they're very traumatic internally. And so what happens is it also alters the pH. I know why people use them. They smell good. It's amazing. You're doing massage work, etc. And then you want to slip it in. But the reality is that internally, the best is silicone-based lube.
Got it. Thank you so much. Dr. Goldstein, I just want to thank you for joining us here today. There was everybody in this room were shaking their heads because we've learned so much. Listeners, if you want to learn more about Dr. Goldstein, go to the She Plus Foundation website. If you like what you heard today, please rate and subscribe to our podcast. For more information on the She Plus Foundation, go to www.sheplusfoundation.com. Remember, sex care is self-care and sexual health matters. Thank you.
Oh, thank you.